So today we're going to discuss how to comply with these criteria without the overhead. So everybody agrees that it's a real challenge, and we today going to discuss the timelines, the solutions for it. So I'm Mike, and I'm Mike from the Health Samurai team, and I'll be facilitating today's talks. We have, frankly speaking, we have 2 talks today, and our speakers will share more details on the certification process, timelines, and other stuff. So let me introduce our first speaker. This is Kyle Meadors, the principal at ChartLooks Consulting. And Kyle will give an overview of the ONC FHIR API criteria. That's all for me. Kyle, thanks for joining us. Please share your slides, and let's go ahead.
Thank you all for being here. Again, I'm Kyle Meadors, founder, principal consultant here at ChartLooks Consulting, and I, previous to this, been working here in ChartLooks for about 6 years, helping mostly developers, but also some other healthcare organizations, providers around understanding and implementing ONC and CMS regulations and requirements. Prior to that, actually was worked at Drummond Group. So it was the EHR testing director there, and then president of the company, which is Drummond Group, is now, I guess, the largest testing and certification body for the ONC. That's actually where I met Pavel there, and how I got to know him. And then we were just talking recently, I guess earlier this year, and about this, and then he mentioned, hey, would you want to come speak on this webinar and kind of just give the overview of the ONC requirements? I said, sure, I'll be glad to, because I talk about this a lot, and most people's eyes roll over when they hear ONC requirements. So hopefully I can make it not so dull here for you, but let's just kind of get into it, and we'll take time. And this is the whole point here. I'm just kind of set up the ONC requirements. Also, some other things maybe CMS is looking at with respect to FHIR, just so you kind of have that background, and then Pavel and his team are going to speak on kind of their offering and kind of how that kind of fits into this. So let me go ahead and next thing here. So again, overview of the ONC requirements, the G10, as Mike mentioned, but I'm also going to talk about a little bit about information blocking, a little bit about kind of CMS's push on FHIR, and just things that an EHR would need for FHIR. And honestly, this is going to be somewhat, I mean, whether it's you're developing it yourself or whether you're going to partner with someone, you know, like Health Samurai or whoever, just things you're going to need to think about if you're a developer, because it's not, the API is not really a criteria like something like, I don't know, like family health history, right? Where you can do it and kind of leave it alone and then move on for years, right? So it's a little different than that. So, well, let's get into it. So the G10 criteria, in the 2015 edition rule that came out, they introduced the APIs G7, G8, G9, and they spoke about, this is about using an API to make patient data available, really for patient facing apps. That was kind of really the only real focus, but they didn't really define FHIR. They alluded to it. They did not define any kind of authorization mechanism. And so they decided in the Cures update to replace the G8 criteria with this new G10 that's going to specify exactly what they want in terms of using FHIR version 4, profiling this data based on the US core profile, using Smart on FHIR, they talk about bulk on FHIR. We're going to talk about all of those here in a moment. And so that's what they decided. They really want to get kind of specific. And again, I'm not obviously ONC. I kind of think my understanding is, though, that, you know, before they had kind of this chicken and the egg thing, right? Like developers were like, well, we don't know if we want to build out APIs because we don't have a lot of app developers asking for it. And app developers were like, well, we don't really want to build an application because people have not unified on the way to make the data available. So ONC is like, all right, let's standardize on these elements. And so that's kind of what led to doing this. And so the US CDI, which we'll talk a lot about, the United States Core for Data Interoperability, which is a version of released every year and updated every year, which is important. They have that data again mapped into FHIR profile. They have some other requirements here, which we're going to talk about in more detail. And then it's all this gets tested using the ONC's Inferno test tool, continuing with the FHIR theme. That's the only currently approved test tool. There is I think going to be another one possibly added somewhat soon this year, but it doesn't really matter if you're getting certified. You're using a certified approved tool, which would meet all these requirements. So I did want to mention too that next to last bullet, the emphasis that it's no longer just patient facing apps, but also practitioner facing, using what they call the EHR launch profile in the Smart FHIR. Also this bulk access component. So they've kind of updated the use cases as well. And by the way, we will have time for questions here at the end. So at the end, just if there's something that whether I covered, did not cover, just be prepared for that, and we'll address that here at the end. So the US Core profile, I mean, you can of course read this, and I just want to highlight a few things here. I think it kind of speaks for itself. You know, it is this idea that we're taking these common data elements and then mapping them to FHIR. They're also doing that to the CCDA, and the FHIR profile would help kind of explains how exactly you're getting access to those resources, right, through the FHIR queries. The US Core 311 standard is currently the only standard associated for the G10 testing, and it supports USCDI version 1. Those who are really in the depths of this, you know that they've actually already come out with USCDI version 2. Version 3 will probably be coming out later this year, but those actually have to get approved into the ONC cert program through a different process called SVAP, Standard Version Advancement Process. And I hope, hang with me, don't get your eyes roll over yet, but here's the key thing is these, for right now, once this process works, they'll just basically kind of raise the ceiling, if you will, and make these as an optional standard. So then they'll have a new core profile, which is actually going to be core version 4, I believe, or maybe version 5, but a new version of core that will support USCDI version 2, and so on. And you can eventually implement those, but you don't have to. For this year, as we'll talk about the timeline, the only thing you have to do is US Core 3.1.1 USCDI version 1 elements. But it certainly can be possible that in future years, ONC is going to have to raise basically obsolete version 1. So if we're in the year 2026, right, 4 years from now, they may send out a rule saying no longer will version 1 of USCDI be permitted in our certification program. Instead, it has to be version 2 or above. And at that point, you'd have to make updates to your certification and your product and your EHR. So that's kind of what I was mentioning, that I don't think that your API functionality is something you can just build this year, set it on the shelf, and not have to worry about it. It's going to require some maintenance going forward. Let me talk about Smart FHIR. A lot of people have kind of struggled with that, and I understand why. I mean, Smart FHIR basically takes the very common internet profiles of OAuth. They also require add an OpenID Connect, and use those to do the authentication and authorization process for for applications. And so that's what you're doing. A client app is wanting to access this EHR, or what they call the API technology in the ONC nomenclature, and the EHR has to authorize or give that app access to that data, or at least allow the user, whether it's a patient or a practitioner or whoever is the user, to approve that authority and grant that access. And that's how OAuth works, in the passing of tokens, these bearer tokens and access tokens. And then they also add in the idea of an OpenID Connect token to help provide information to the app about who the user is. And again, this is all under the control of the user, patient or provider, or whoever's using it. But you have to set up the infrastructure for that, right? You have to have some kind of authorization server, identity server, and there's a lot of ways to do it, whether that's all in one or it's somehow set up differently. That's all throughout the magic of the OAuth process. But it is something that, a lot of people in the pre-cures in 2015, they were maybe just doing certificates or some simple HTTP authentication. Now it's going to be standardized. So again, it's not just building out your FHIR resource library and getting data there. You also have to handle the authentication part of it. So it is important to make this whole app ecosystem work. That's really the reason behind it. But it is something you have to do. And the Inferno test tool, the one that we have right now, will test all of these scenarios. It'll test all those USCDI data elements through the US core profile that you'd have to implement. It would also test all the Smart on FHIR aspects of the different launch app mechanisms, standalone app launch, EHR launch app, and all the different redirects that have to be done to make sure it works. So all that gets tested in the Inferno test tool. And so again, you as a developer or someone who's looking to have this ONC certified capabilities, you have to make sure your technology has those, the US core implemented, the FHIR resources implemented that way, and the Smart on FHIR authentication authorization components there. And then kind of the last piece of G10 that you need is this US bulk FHIR, which is the idea of using like bulk data elements, or actually bulk, excuse me, getting access to bulk patient data. So most of FHIR, you think traditional FHIR, right, is an app connects into the EHR or the health system and makes a query on a patient, you know, and returns data on that patient. And that's kind of what most people think of. What you can use through this bulk access profile implementation guide is obtain a large amount of data. So you can define a group, right? So maybe it's certain patients who are seen by a provider, or maybe patients who have just a certain diagnosis. It's called a group ID. And you can define that. It's a little open. It's ONC just wants to make sure you have, if you want to say the plumbing in place where you could do that, you'll still have to do in deployments, various setups for this. And so like the use case could be for like population health or something where you're getting large amounts of patient data there and pulling it over. Maybe research situations, right? Research data where they're wanting to get certain patients, and you're just getting a large volume of data. It's actually an asynchronous kind of form of communication. You go and you make the request, and the technology builds this, puts it in what they call a non-delimited JSON file, ND JSON. Then later on, the app comes back and says, "Hey, is it ready?" And this is yes, it's ready, and it sends it over. So that's the idea behind it. I mentioned here, I'm actually not personally aware of any apps right now that are actually using this. And apps, of course, I'll use that term a lot. That's a kind of a general term, right? It could be an app on your phone, or it could be just another big application on a server somewhere that's, you know, working with you. I'm not aware of anyone using this yet, and you certainly may be, and maybe you can mention that later on. But I do think you're going to start seeing this happen more. Obviously, once people begin with ONC's vision, if people build this infrastructure, now app developers have a reason to invest their time to do it because they know that there's a large volume of patient data available through these numerous EHR certified technology systems out there who can support this. So I think that's what will happen. And we'll see kind of obviously going forward what really happens there. But so again, all three of those things have to be in there for your G10 certification, and the Inferno test tool will test all of that. So, you know, if someone says, "Hey, we only care about the patient facing app part," and I can understand that, that's probably the more common one that people are going to use, you still have to have the capabilities to do everything else, practitioner, the bulk access, and the Inferno test tool will test it. And so Smart on FHIR, same thing. I mean, everything's going to get tested, and there is, I think, definitely some gray or some wiggle areas. Things are not defined in the ways to implement this, or flexibility maybe is the more positive word that you can do. So it's not necessarily a one size fits all, but ultimately you do have to fit into this G10 criteria, and everything has to be done, and it has to be done for those who are so inclined to maintain their certification status by the end of this year. And actually, it's not just certified, actually, it's really means certified and made available to your customers, which is a challenging point. And I won't get too much into that. I guess obviously I'm a consultant. If you have more questions about how to handle these situations, you can speak to me at any time, Kyle@chartlux.com, and I'll be glad to chat with you about it. But the biggest thing that you have to just to know is that ONC expects people who are currently G8 certified to have G10 certified and deployed to their customers by the end of this year. And which, of course, certification means you have to work with one of the authorized certification bodies like Drummond Group, or there's SLI Labs. And that has to be done this year and then available to your customers. So it's obviously it's a significant task. And if you're there's also this maintenance of certification, maintenance and conditions of certification for those who are certified now. You probably have had to turn in your attestations earlier this year to ONC saying that, hey, we are in line with these requirements. Well, this is one of them. that you have, if you have API technology, if you're not certified now, that's fine. But if you are G8 certified, then you now are kind of on the hook, if you will, to get G10 deployed and rolled out. And I'll just say it. People ask, well, Kyle, what do you think the chances are of ONC extending that deadline? And I'll just tell you, I don't think there's any real chance, and it can always happen. I mean, it has happened in the past of not this criteria, but other things. But we already are starting to see some systems, usually these are the larger ones, who've already kind of implemented themselves, who are G10 certified. You're going to see more who will be ready. I just don't see, it's not a case where ONC is going to look at it like, oh, no one's doing this, we have no choice but to push out. It's going to happen, and then you're going to have to kind of deal with this. And if you don't have it, so what's the repercussions of that? If you have customers, aside from the ONC non-compliance part, if you have customers who are in CMS programs that need what they call CEHRT, certified EHR technology, like for the MIPS program is the most popular one, they have to have this for their promoting interoperability measures that they submit, and you have to have cert. And G10 will be replacing G8 as part of the base EHR requirements for cert on January 1, 2023. So your customers, your providers now would not have fully certified technology without G10, which means they could not submit PI measures, which means they can't get those points, which means their MIPS composite score is going to be lower, which means likely they're going to get a negative adjustment if they are in the MIPS program. So that's the carrot stick, or I guess it's all stick maybe, for you that you have to do. Again, if you're not in the CMS, if your clients aren't in the CMS programs, maybe it's not as big a deal. Again, there's always nuances to every person's situation, but that's the timeline. Let me say a couple more things here, and that was my main things I wanted you to get across before I share it with Pavel and let him actually demo it, which really is kind of the purpose of this really webinar. The main focus here has been this G10 certification. There is some other things ONC and CMS are doing. One is information blocking. I just want to point out that you don't have to, information blocking doesn't mean you have to have a certified API necessarily. It just means that data has to be ultimately made available, and there's a thing called the content and manner exception, so you can provide your data in different ways. It doesn't have to be the API. So I think that's one thing. There is, though, I will say a lot of people have thought they want to go ahead and not just take the FHIR and use it for the US CDI only, but they've actually looked to expand it and add in more data elements to kind of help address this information blocking, which talks about sharing all your EHI. Again, it's not a requirement for cert, but I just want to mention that some people are looking at that. So it's something you may want to think about, not just stopping at US CDI, but also adding some other data elements. Again, a lot of unique decisions unique to your situation you have to consider, but I did just want to mention that. CMS is, kind of sitting here in the background. I mentioned the MIPS program already as kind of a driver, but there's other things that CMS is looking to do to really drive the adoption of FHIR. They've released some rules regarding payer systems, making their data available, patient data available through FHIR. Again, those are not an ONC certified requirement necessarily. Same thing about using like a prior authorization using FHIR. But it just kind of points that CMS, along with ONC, is really, they're kind of pushing their chips all on the table, right? To use a card metaphor or whatever, of playing cards. They're really banking on FHIR. In fact, they've also announced plans to eventually move toward, they call digital CQMs, DCQMs, which utilize FHIR. These are a lot of things are to be determined, but I just want to mention that it just doesn't seem like, if you're wondering, like, is this really worth my development time? Again, whether you're going to go with Health Samurai or any other partner out there or develop yourself, and I'm trying to be somewhat neutral in that regard here, of just saying this is, where I'm coming from. You just can't, this is not something I think is going away. Health IT and the powers that be are going to be continuing to emphasize FHIR and want to use it in more ways. And it makes sense if you've already developed this infrastructure in place to really then utilize it. So it just seems like this is something that's going to get more and more important. In the last slide, and I'll turn it back over to Mike and Pavel. Obviously, the immediate need for anyone who is currently G8 certified is to get a certified solution G10 in place this year, whether it's yourself or through a partner or whoever. Years ahead, you're probably going to have to maintain this. The US CDI version 1 eventually, I believe, would get obsoleted, and they'll raise the floor to maybe version 2 or version 3 or so on. So it's something you're going to have to maintain. You can't just build your FHIR resources and then leave it, right? Something's going to have to be maintained. And especially if this adoption really takes off, it's going to have a robust solution in place. I mean, it's something you have to think about. I just mentioned, think about your contracts and stuff and how you have to kind of factor that in with your customers. That's off topic here, but in case the volume load gets high, a lot of things to consider. And I just really do think that FHIR, and I'll be honest, I've not always been a FHIR, I guess, only enthusiast or evangelist, I guess. I've always, FHIR's good. There's other ways to share data. And so, but I've had to acknowledge last year or two that, man, those who CMS, ONC really are pushing FHIR almost in every way they can. So I do think, just my professional opinion is, it's worth, making sure you have resources available, or commit to somehow partnering with people, whichever way you do, to make sure you have a robust FHIR solution going forward. I totally believe in doing whatever you need to do to meet requirements, but maybe then focusing elsewhere to help your customers who's going to make money. I mean, there's trade-offs you have to make, but I just don't see this going away. So that's really why I wanted to give you that background. And I'll go ahead and stop my part of the presentation. If you have any questions about this, about the ONC cert part later, let me know, and we'll take in the questions. But I'm going to turn it, I think, back over to Pavel now for him to present on his part. I think that's right, Mike.
Yeah, thanks a lot. Please feel free to put questions to Kyle to the Zoom chat. We'll have a Q&A session after Pavel finishes his talk. And now let me introduce Pavel Smirnov, the CEO of HL7. He will give an overview of the Aidbox FHIR API module and explain what the HL7 team has to offer to EHRs. So Pavel, please go ahead.
Hello. Okay, so my name is Pavel, and I'm CEO of HL7. I'm going to tell you about pluggable Aidbox FHIR API module for EHR systems. And first of all, I want to speak a little bit about HL7 itself, so you understand why we are not strangers to EHR systems and to FHIR. So first of all, HL7 started as a EHR company back in 2004. So we know what development of EHRs is about very, very well. But then we also joined the FHIR community back in 2012. And since that time, we have been working on FHIR platforms and FHIR backends for health IT developers. Nowadays, like we started with Firebase in 2013, open source storage for FHIR data. And later in 2015, we introduced the first commercially available FHIR platform to the market called Aidbox. Nowadays, Aidbox is used by almost 100 clients, and there are a lot of production implementations. So again, we are not strangers to EHR systems, and we are not strangers to FHIR. So Kyle told you a lot about G10, 21st Century Cures Act requirements. So let's look at these requirements from the perspective of what you need to implement as EHR developers, what you need to bring to your product. First of all, of course, you need to implement FHIR API. ONC chosen version 4 for this year. And you can implement perhaps not the full FHIR API, but a subset of FHIR API, which is defined by a US core implementation guide. And you need to bring this FHIR API for all US CDI data elements. But that's not it. In addition to that, you need to enable smart on FHIR applications to run from these APIs. And this smart on FHIR applications needs to be enabled for patients and also for practitioners. there are two types of launches which you need to support. One launch is a standalone launch when application is run outside of the EHR system. And also you need to enable EHR launch when applications are started within the EHR system. Besides that, you need to enable bulk data access. So you need to implement bulk data export specification, FHIR, and perhaps to support all these applications, you need to have some type of UI which will allow all these workflows. We call it internally like a portal, which enables developers of third-party apps to come and register their applications and maybe test them against the sandbox. EHR administrators need to approve or deny these registrations and manage these applications. And of course, there are patients which should be able to see what applications are available and be able to launch these applications. So they need to provide consent to share data with these applications, and maybe remove these consents if they change their minds and don't use the application anymore. All this needs to be secured and documented properly. So that's kind of like a scope of work which you have to deliver to be compliant with G10. How you can achieve this? So there are a few possible routes. One route you can take your team and start building all these FHIR APIs yourself. And this definitely gives some advantage. Everything is going to be under your control. You will have one source of truth for your data. And perhaps you can use the same technology stack for FHIR technology and for which you used for your EHR development. This is a path which you can take, but it's a hard path. I can tell you from our experience. We spent many years developing FHIR API. So you will have to grow this expertise internally, and that's not a simple task. Overall, you have lots of work to do. You will need to develop all these modules, which I described at the previous slide. And you will need to certify and maintain this certification for the future. We have seen a few implementations of this type of API facade on top of EHR systems. As Kyle mentioned, some large EHR vendors already released FHIR API for their EHRs. What's happening with all this type of implementations is they usually provide a very limited FHIR API, and if you want to get something more than just API which is for certification, just more than few API endpoints, again, this will take a lot of additional efforts from you. The other potential problem on this path is with performance, because your internal database of your EHR is not might be not the most efficient database for making FHIR API queries. So this really can make this FHIR API queries working slow. Might be hard to optimize them. And also, if your API will be used intensively, this can also slow down the experience of regular EHR users, which are not working through the API, but working with the same database. So again, there are pros and cons, and this is one route. The other potential route how you can become compliant with the G10 rule is you can choose an open source file server from the market and integrate your EHR with this file server. Again, there are benefits of doing so. open source FHIR server most probably will have all the required FHIR APIs you will need for certification, and you will keep again most of the things under your control. You will have no vendor lock-in with your FHIR solution. In this case, you will replicate data from your EHR database to the FHIR database, which will power the open source FHIR server. And this might create potential problems with synchronization, and also you will have to pay additional costs for additional infrastructure. You will need to build perhaps less expertise versus building your own FHIR server, but still you will need to build some expertise internally for using this technology. And the last but not least, with this approach, again, still quite a lot of work to do, because open source solutions do not come with a full package for ONC certification for G10, and you might need to put additional efforts to make Smart on FHIR work, to make bulk data export work, to build the portal for app registration and consent management. And at the end of the day, you still need to certify the solution and maintain the certification. And of course, there is a third path, which we call this presentation pluggable Aidbox FHIR API module. So you can take a commercial FHIR API module from a vendor like Health Samurai and connect it to your EHR system and achieve compliance through this commercial module. Aidbox pluggable FHIR API module comes with all the FHIR APIs you can think about for now and the future. And integration for data can be achieved most probably quite easily with use of CCD to FHIR adapter. Most of the EHR vendors which are certifying for G10, they have certified the EHRs for 2015 rules. And 2015 rules had a requirement to expose data, UCDI data over CCD format. So if this functionality is already built, it is possible to use the CCD to get most of the data which is required for G10 certification and connect EHR to Aidbox with this CCD to FHIR adapter which we have developed. Aidbox comes with all the modules which you need for G10 certification, and certification itself is coming. We already working with the ONC certification body, ICSA Labs, and the timeline of certification is pretty close. We are getting certified next month, July of 2022. Comparing to two previous routes, you don't need that much of expertise around FHIR because Health Samurai provides support and education for your team and can help you stay compliant and answer all your questions and help you with integration and implementation of Aidbox. There are, of course, disadvantages of this solution as well. With Aidbox, you still need to replicate data from your EHR to Aidbox FHIR database, and it incurs additional infrastructure costs, and of course you need to take care of synchronization, and there is a vendor lock-in since you're using a commercial solution. I want to say a good vendor lock-in, not only because Health Samurai is a good vendor, but also from our experience, vendor login with using FHIR servers, FHIR solutions is usually not as bad, because the data is can be easily exported from any FHIR solution in the FHIR format, like using bulk FHIR API, for instance, and loaded into another FHIR server. So if for some reason you don't like to work with Aidbox like a few years later, you can relatively easy switch to a different vendor. So lock-in is not so bad as sometimes it happens with EHR vendors, for instance. Here we put a table which compares three types of implementation which I described, and estimation for the first approach, when you build from scratch all the FHIR APIs, really can be quite long, especially if you want to build a good product with rich FHIR API, and all the features which are required for certification can take a few years. Our not very small team is working on FHIR API, FHIR server, again, since 2015, first release of Aidbox. Building on open source is faster, and maybe an okay route, like if you start in 2021, but still our estimation that it will take 7 months to year and a half. So it's still quite a lot of efforts, and the deadline is coming in December, right? For Aidbox implementation, most of the work are around integration, and we help to do this implementation project. So our estimation is significantly more comfortable. So it's 1 to 3 months. Yeah, one more time about Aidbox certification process. So we have a green line with all Inferno tests. Aidbox FHIR API module is tested regularly. Inferno is built into CI/CD pipeline, and we have actually a publicly available Aidbox instance, which anybody can register with and run all Inferno tests and see how it complies with all the requirements. We can share a link if you request it. Aidbox is being certified by ICSA Labs, and certification is coming July of 2022. Kyle talk about this a little bit. I want to emphasize this too, that compliance is not a one-off task. It's a long-term process which will require continuous work from you in the future. One thing is coming in 2023 is in addition to G10 requirement, there is a B10 requirement for full EHI expert, and Aidbox can be of help for this criteria as well. Aidbox supports custom resources, and even if the data doesn't fit FHIR, you can use the same approach to load data to Aidbox and expose it over documented API, all the data about your patients, as it is required by B10 certification rule. And ONC has proposed this SWAP process, so new versions of standards are coming, and coming soon. HL7 R5 might be released this year, as far as I understand, and Smartphone 5 version 2 is coming, USCDI version 2, version 3, new versions of US Core. So all the standards are evolving rapidly and being adopted by engineers. So unless you want to join, like build a company which builds FHIR servers, it might be a good idea to find a partner that will take care of this for you, like long term. And the last but not least about Aidbox. Aidbox is useful not only for compliance. We have a lot of clients that build quite comprehensive solutions for healthcare on top of Aidbox. You can surround your EHR system with useful third-party apps to complement your EHR offering. You can build FHIR first modules for your EHR system. Some of our clients call Aidbox API FHIR API++ because it complements FHIR with many useful functionality. There is also GraphQL available, SQL on FHIR, granular access control, custom resources, a lot of interesting features which help to build powerful applications on top of Aidbox. And since you load all your data into Aidbox, you'll get a FHIR CDR with your data. And Aidbox has a unique feature, SQL on FHIR, which allows using of Aidbox for business intelligence, for data analytics. You can calculate quality measures with SQL on FHIR and like translate SQL clinical quality language to SQL queries and run it on top of Aidbox. So there are a lot of benefits in addition to just being compliant, which you can get from Aidbox. And I want to invite everyone who wants to see all this beauty in action, use this link to book a video call with us so we can demonstrate Aidbox pluggable module to you, and also discuss maybe how you can integrate it and deploy it into your infrastructure. Thank you.
Thanks a lot, Pavel. And it's time for questions and answers. I would also like to mention that we have here the CTO of the Health Samurai company. So Nikolai Ryzhikov is also here. So if you have any technical questions, please feel free to give them. I see that Kyle has already answered Shamil's question. But Kyle, could you just elaborate a bit more on the question?
Sure, it was in the chat, but basically, because I alluded to the CMS Patient Access API, and then the question, Jamil, was, does the G10 address that, like any of those Da Vinci profiles or the other ones that they mentioned? And my response is no. I mean, the G10 is just kind of the 3 US core, there's just FHIR version 4, the US core, Smirnov FHIR, and then the bulk access, and that's it. So those CMS aspects are separate. And I didn't mention that Drummond Group has its own cert program that's based around those profiles themselves. So there is some industry kind of support for that, but nothing on the ONC side. So again, I think ONC, they could possibly add that later on at some point. We'll have to see where CMS goes. Obviously, I think for now, CMS or ONC just wants to get the G10 out. But yeah, that could be something that happens later on in the future. But all those CMS requirements that put forward those are effective according to CMS, and they don't necessarily there's no cert requirements with that, which is going back to kind of what I was saying earlier, that you can't only look at the ONC G10 and think that's the only thing that's happening on FHIR. So
may I ask a quick question just to follow up?
Yeah, sure.
So everything, only those that are mentioned in the CMS 9115F document, only those APIs are supported? Is that all?
You're talking about for the G10 or the patient access? I'm not sure. I didn't.
Yeah, for 315G10.
Yes.
There is a related document called CMS 9115F, and I believe it mentions US core, Smart and FHIR, bulk API. Everything else is not there. So can I assume that only that document covers everything? Is that correct assumption?
I think so. I maybe get a little confused on the document. It's always so hard to hear it and not seeing it.
Okay, I'll just.
But I mean, Shamil, if I didn't really answer, feel free to my email is Kyle, Kyle at chartlux.com. That's for anybody. I'll put that in the chat right here. You're all welcome to email me a question later on from this if I didn't address that well. So, I mean,
Okay,
the
thank you
GTN
very much.
is
Yeah.
just that scope. The CMS stuff using hand gestures should it's something. There is overlap of standards, but there's not a cert requirement linking those together. Like they reference obviously the US core stuff, but then they add some other things with the Da Vinci profiles and so on, and those are all kind of separate, and there's not really a linkage there. So
Okay, thank you. I'll follow up with you.
Go on, one more question. If we don't certify for the G10, then we cannot call our EHR as base certified EHR, right?
that is correct. As of January 1, 2023, the base EHR requirements change. I did want to make a point though that, you know, base EHR, even though I know EHR developers a lot of times call themselves that, it's really about your customers having base or having cert. And what I mean by that is, you know, if let's just say with Health Samurai's point, like they're going to get G10 certified. If you then partner with them and integrate that in there, you don't need necessarily to get the certification for G10. You can just kind of refer to theirs in terms of how you go to the chapel and get your cert ID and so on. That's option available. Yes, you lose the ability to call yourself a base EHR. And if that's important, then if you partner with like Health Samurai, then you would need to do the testing yourself and get certified where it's on your own certificate of G10 to maintain that. And I know sometimes that's a marketing decision that's needed, but your users wouldn't need that. They can just simply refer to your certification, which has all the cures updates and so on, minus the G10. G10 is certified for on Aidbox, and you put those together, and then that gives you base EHR coverage, cert requirements, etc. So, but yes, that is, I mean, yes, to be very basic to it, right? If you don't have G10, G10 is now, well, January 1 will be necessary to be base EHR.
Thank you, Kyle. Any other questions? If you don't feel that you are too speedy to type, feel free to speak. That's my message to the audience. No
Hi,
questions.
oh, sorry, I had a
okay.
question.
Go
I
ahead.
was wondering about CDS hooks and where those stand in terms of the regulation, because I didn't see that mentioned at all today.
That's a good point. Yeah, that's definitely one that I hear a lot about. And it, you know, in the ONC world, I think they may have occasionally even made a reference that in one of the preamble statements. I have to go back and look. There's nothing there right now. Let's just put it that way. There's nothing there that says, hey, CDS hooks is going to be a requirement. You know, which of course, for those who don't know, is kind of obviously using FHIR and clinical decision support, kind of merging that together. There's nothing there right now. And I will just say, I do think there'll probably be an ONC reg later this year. This is a whole nother topic. I do think something may come out more minor, probably dealing with some things related to their what's called the EHR reporting program. That could be next year, early next year. There will be something. Could they possibly add that? I guess. I just feel like, in my personal view, professional view here, that G10 itself, as it's written, is a hard enough lift. So they just need to get through that. And they could then later on add something there, but there's nothing on the CDS hooks right now that is required for a cert aspect. But that's a great use case, and I think that is something to think about there, Jonah. About, you know, if you're going to invest this time, resources into having FHIR, can you make it useful? And the CDS hook seems like it's something that, you know, and I don't have a lot of personal experience with it. I'm just things I've read could be really useful.
Okay, thanks.
Thank you so much. Any other questions?
Hi, it's Nikolai.
Hey, Nikolai.
Yeah. Kyle, can you tell us how usually the certification process looks like? What phases, what should people expect from the certification process?
Well, you know, you just so you know, you register with a certification body, Drummond, SLI, ICSA. Usually they're setting up like in G10 in particular, you'll have to set up a test date that'll be done. It's really important. They need a person there to observe this. This is a live test criteria. Some other criteria do only require self-declaration, so that can be done. But I always tell people, you're probably, whenever you think you'll be ready to test, you need to register at least 2 to 3 months before then. So even though, it's not like hey, it's ready, I want to test now, because they don't quite work that way. They have to have paperwork to get signed up and so on, and then you find your rates. On top of this year, there's already this big push for the end of this year. I think Drummond sent out something recently about, they're saying basically the end of the year is starting to fill up. So I think a lot of people are pushing off to December if they can. So you're going to need to get a certification date sooner than later. But, I should point out though, for all that kind of preparation time and then some of the paperwork that has to be involved, like for G10 itself is actually it's a relatively easy test. Like you're using the Inferno tool that's public that you can practice with, but you show up on your day of the test, November 1st, for example. I don't know when that day is. I'm just making that up. But you show up, Drummond would set up a webinar link. You would connect in, share your screen, talk a little bit about your system. You'd show how it's hooked up to the Inferno test tool, which is simulating a client app connecting to your Inferno server. And you'd hit run those tests, and it would go through and run them through, make sure they're all green. You'd be necessary to set up all the data in advance. And there's some instructions they have about that. And it would go through, and once that testing is done, the proctor would say, hey, this looks good. Formally, they have to then, that's the testing side of things. And they have to submit those results to the certification side of the house. That's usually a couple of weeks to process all that. There are separate parts. For the most part, though, they generally, if you pass testing, you should feel confident of certification. So there is steps of the sign up, scheduling your date. You can talk with your proctors before then, the day of the testing, where everything kind of builds toward. I should point out, if you do have errors, you can typically, you can get a reschedule. But I should point out that everyone is kind of delaying this stuff, is what I can hear, because it's hard. And so I would encourage you to get your dates sooner than later. Honestly make your decisions, going back to what this discussion is about. You need to make your decision of what you're going to do. Are you going to implement this? Are you going to partner with someone like Aidbox? That probably needs to be done sooner than later, because this stuff is going to come up pretty quickly. Obviously, we have 6 months left in the year at this point. So that's a little bit, Nikolai, kind of how that works.
Thank you.
Thanks, Kyle. I got a quick question. Can all these functionality be tested on the pre-production environments or in the EHRs, or
Okay.
it has to be a production?
Yeah, that's a good question. For the certification testing, you can use like a dev or pre-production environment. That's fine. Obviously, you almost probably have to, right? Because you're not certified yet, so you really probably shouldn't be pushed into production. So that's not uncommon at all. In fact, I know the proctors they don't want to see live patients. They want to make sure it's all synthetic, all created patients. So you'll need to go ahead and make sure you have an environment set up ready for that test. I would do a lot of run-throughs with that. Maybe hire a consultant to help you with that. It's a little plug for me, but you would do all that and get that ready. Now, then once that's done and you're certified, that is what certification means, that it doesn't just live in or stay in pre-dev or dev pre-production. It does get migrated. And that's what I mentioned about the January 1 deadline. It's not just you're certified, but it's now been pushed and available to users. Even if your users aren't just eager to use this, it is supposed to be in production at that point. So that's another thing to think about with your timeline, right? Yes, you test in pre-production and dev, that's fine, but it's got to get rolled out. It's got to get deployed to customers. You need to get things on your website with all your instructions and information about it. So there's a lot of stuff that have to be done. And this is a project, a full project that needs to have someone managing it and overseeing it and supporting you on that.
Thank you so much. Any other questions? We got like 3 minutes left.
Hey, this is Amit. I have a quick question.
Mhm.
So if we get partner with let's say like a company like Aidbox, okay, Samurai. So do we have to show the integration to the proctor?
That's a good question. I mean, it's only if you are wanting to, if you're wanting to make your certification certificate have G10 on it, which means it's your certification. You have to live test it, which means you have to go through this, and they can't just grandfather and say, oh, well, look, we've integrated with Aidbox and they're already certified. The proctor's like, no, we have to actually, you have to do the Inferno test. So that's kind of how that works. So there's that part. However, if you just are going to integrate with them, and it is integrated. It's there. It's going to work in production. When you go for your work with the other cures updates requirements that are required, there are some criteria that have to be cures updated. You do not need to, and you're just like, listen, we're not going to have G10 listed on a certificate. That's what Aidbox does. We're just going to reference that in the chapel to kind of link those together, which is how you do a lot of times with your HISP or maybe a doctor first for e-prescribing. That's not an uncommon thing. You do not need to show that integration. And CMS has talked about that, ONC has talked about that's kind of where the real world testing, the surveillance activities come in. ONC is saying, listen, you don't need to tell the ATL how it's integrated at that time, but it is presumed, obviously, if your customers are claiming that for their MIPS standards, that it's actually truly integrated and working. So, I mean, it can still be addressed that way, but you don't need to show that, again, unless you want the G10 certificate listed on your EHR's certification. In that case, you have to live test it just like if you develop it on your own. So anyway, I hope that makes sense. It's a little, yeah.
Thanks. And just last quick question. So if we get the Aidbox certification ID and we mix it with ours, so that's not going to hamper our client's MIPS score, right?
That's correct, right? Yeah, it's just because you go, for those who've not gone, you go to the chapel, like you would add your product, you'd add Aidbox plus anybody else, a HISP, whoever you're working with, and it creates what they call the CMS EHR certification ID number. They all these IDs that you have out there. That ID is actually what's turned into CMS for the MIPS stuff, and it's no different than if it's your product as a whole doing everything, or if it's several pieces together. It's, as far as CMS is concerned, it's kind of, I call it like stacking Legos, right? You either have one big Lego piece or several that stack up to the same size. That's all CMS cares about. And it doesn't make any improvement or diminishment of your MIPS scores. You just have to have CEHRT, certified EHR technology, whether that's one or many products together.
Yeah, thanks a lot.
Thank you so much. Unfortunately, we are out of time. It was a very exciting hour of my life. Thank you, Kyle. Thank you, Pavel. Thank you, everyone who joined our today's meeting. In case you have any questions, please feel free to reach out to us. We are happy to answer. And if you want to see the live demo of the Aidbox FHIR API module, please book a meeting with us. We will be happy to show it in action. That's it. Thank you so much. Have a good day.
Thank
Bye-bye.
you.
You guys, bye.